My name is Yael Mizrahi. I lead our global partnerships at Mobile ODT. I joined the company in 2015 when we first got CE mark and began commercializing our product. To give you just a little bit of background on our company, we are a socially minded digital health company that's focused on really making healthcare tools accessible to individuals everywhere in the world in order to be able to save lives. So at the moment, we are currently operating in, it's not showing up for some reason. Oh, there it is. We currently have almost 50 employees. Our headquarters are based in Tel Aviv. I'm based in London. We have team members in Chennai, India, Nairobi, Kenya, in San Francisco, and in New York. The first country that we started working in and commercializing in was Kenya because of the low regulatory hurdles to enter the market, the incredible amount of burden of cervical cancer, and the partners that we had to be able to start not only piloting immediately, but also to be able to scale up quite rapidly. So the Ministry of Health of Kenya has purchased the technology and is using it now in 4 different counties on a national level. So for those of you don't have much background on cervical cancer, it's actually the 4th most common cancer amongst women in the world, bless you. It is the 2nd most common cancer for women in emerging markets and in low resource settings, including in the United States. And it takes the lives of over 300,000 women every year. Now, the most shocking thing about this is that you might know, your wives might know, your partners might know, you do get notifications to go in for a screening. It's a cancer that's very easy to catch early, and if it's caught early, it can be treated in a matter of minutes with very simple procedures of just remove of excision. And so there is no reason that women should be dying of cervical cancer. And yet so many women are, because it takes too long to be able to get the results back about whether a woman's positive or negative. For cervical cancer, it's often inaccessible, the actual screening, and oftentimes it's inaccurate. So if we think about the pap smear, it's only about 70% accurate. And that's where our EVA system comes in. So this is the equivalent of a Welsh Allen digital colposcope, which is currently used in most parts of the United States and across the world. But the colposcope that it's comparable to is actually the size of this podium. But what you're looking at, you get the same thing in the palm of my hand. It has the same light source, the same optics, which give you 16 times magnification, and infinitely more when you actually use our application that's available on the phone itself. And everything can be managed inside of a smartphone that's built into the system. Now, this is already FDA approved and CE marked, and can be used for screening, for documentation, and also for remote telecolposcopy. So it's regularly being used across 23 clinics in California right now for remote telemedicine, where they're able to expand their services and increase their business just by providing these services at the point of care where they weren't able to previously, and utilizing a remote consultant. What's most exciting is that we've been working with the National Cancer Institute for the last couple of years on developing an artificial intelligence algorithm that was recently validated just in December 2017. It was validated and found to be able to identify cervical precancer at 90% accuracy. So infinitely more accurate. And if you look at over here, this ROC curve, it's more accurate than cytology, than other standard of care pap smears, actual visualizations of experts. The artificial intelligence outperforms all of them. The way it fits into the screening model is that you can do it as a primary point of screening. And you get, the best part is that you actually get an immediate result. It's all based on a visual evaluation. So a woman can go into an exam and have a speculum inserted, use the machine to evaluate them, and within 2 minutes have a response immediately whether she needs to go on for treatment or not. And in cases where, such as the UK, where they're doing HPV testing as a primary screen, this can be a fantastic triage to cut costs for the healthcare system and, of course, provide an immediate result, which is really not only helping a woman's anxiety, but also helping you treat the women who need the treatment the most as quickly as possible. The first place where this was tested was in South Korea. The testing was done last April. We ran a pilot from January of last year through the end of April and presented those results to the American Society for Colposcopy and Cervical Pathology. We found that the test was 92% accurate when compared to biopsies. And that's really what we're trying to now roll out. We're in the process of getting FDA approval for the diagnostic. And in the meantime, it's being used as a second opinion across different countries in Europe, in Latin America, and in Southeast Asia. The technology can be used, like I said, for colposcopy, for immediate evaluation of the patient in settings where they're doing visual inspection with acetic acid, for artificial intelligence, and also for sexual assault documentation. And really, this is just a start because this is our first application. We wanted to see how well we're performing in one particular area, how quickly we're able to really capture the market with that, and then from there, scale up to other applications, really anything that can be visually based. Now that we have the foundation and the understanding of how the artificial intelligence works based on visual examinations, we're looking to scale up and go into other areas as well. Thank you.